Mpox is a disease caused by a virus. It was first found in monkeys. That is why it is called Mpox. The virus can spread to humans. This can make people sick. Mpox is not new. We have known about it for many years. The first human case was in 1970. Since then, there have been outbreaks in Africa. Recently, there have been cases in other parts of the world. Mpox is a serious illness, but most people get better with time. We need to work together to stop the spread. We can do this by learning about Mpox and how to protect ourselves. The Mpox spreads in a few ways, and understanding these methods is crucial for prevention. One primary way is through close contact with an infected person. This can happen in everyday interactions, such as hugging, shaking hands, or even helping someone with mobility issues. Close contact includes touching their rash or body fluids, which can contain the virus. It's important to be cautious and use protective measures when in contact with someone who might be infected. Mpox can also spread through respiratory droplets. These droplets are tiny particles released into the air when an infected person coughs or sneezes. These droplets can travel through the air and be inhaled by others, making it essential to cover your mouth and nose when coughing or sneezing to prevent the spread of the virus. Another significant way Mpox spreads is through contact with contaminated materials. This includes items that have been in contact with the virus, such as clothing, bedding, or towels. Contaminated materials can harbor the virus for a period, making it crucial to handle them with care. Washing these items thoroughly and using disinfectants can help reduce the risk of transmission. It is important to avoid touching these items if you suspect they might be contaminated. Always use gloves and wash your hands thoroughly after handling potentially infected materials. Some groups of people are at higher risk of getting Mpox. Understanding who is at risk can help in taking appropriate precautions. These high-risk groups include people who have close contact with someone who has Mpox. This can be family members, caregivers, or anyone living in the same household. Healthcare workers who treat Mpox patients are also at higher risk. They are often in close contact with infected individuals and must take extra precautions, such as wearing protective gear and following strict hygiene protocols. Regular hand washing, using hand sanitizers, and wearing masks are essential practices for healthcare workers to protect themselves and prevent the spread of the virus. Public awareness and education are key in preventing the spread of Mpox. Community health campaigns can help inform people about the risks and the necessary precautions to take. By practicing social distancing, wearing masks, and maintaining good hygiene, we can all contribute to reducing the transmission of Mpox and protecting those at higher risk. Knowing the symptoms of Mpox is important. Recognizing the early signs can make a significant difference in managing the disease and preventing its spread. Awareness is the first step towards taking control of your health and protecting those around you. Early detection can help stop the spread. By identifying the symptoms early, you can seek medical attention promptly, which can lead to better outcomes and reduce the risk of transmission to others. Public health campaigns play a crucial role in educating communities about these symptoms. The first signs of Mpox are often flu-like. These initial symptoms can be easily mistaken for other common illnesses, which is why it's essential to pay close attention to your body and any changes you may experience. You may have a fever, headache, or muscle aches. These symptoms can vary in intensity, but they are usually the first indicators that something is wrong. Monitoring your temperature and noting any persistent headaches or muscle pain can be helpful in early detection. You may also feel very tired. Fatigue is a common symptom that can accompany the initial flu-like signs. This overwhelming sense of tiredness can affect your daily activities and overall well-being. A rash usually appears a few days later. This rash is a distinctive feature of Mpox and can help differentiate it from other illnesses. It's important to observe the development of the rash and seek medical advice if it appears. It often starts on the face and spreads to other parts of the body. The progression of the rash can be rapid and it may cover large areas of the skin. Understanding the typical pattern of the rash can aid in early recognition. The rash can be itchy and painful. Managing the discomfort associated with the rash is important for maintaining quality of life. Over-the-counter creams and medications can provide some relief, but it's crucial to consult a healthcare professional for proper treatment. It goes through different stages. The rash evolves over time, starting as flat spots and progressing through various stages before healing. Each stage has its own characteristics and can provide clues about the progression of the disease. It starts as flat spots, then becomes raised bumps filled with fluid. These fluid-filled bumps are a hallmark of Mpox and can be quite distinctive. Observing these changes can help in identifying the disease early. Finally, the bumps scab over and fall off. The healing process can take some time, and it's important to avoid picking at the scabs to prevent infection and scarring. Proper skincare during this stage is essential. If you have these symptoms, see a doctor right away. Early medical intervention can make a significant difference in the course of the disease. Don't hesitate to seek professional advice if you notice any of these signs. Early diagnosis and treatment are important. Timely medical care can help manage symptoms, prevent complications, and reduce the risk of spreading the disease to others. Stay informed and proactive about your health. There is no specific treatment for Mpox. However, there are ways to manage the symptoms. Your doctor may recommend medicine to reduce fever and pain. They may also suggest ways to relieve itching. Rest is important when you have Mpox. Drink plenty of fluids to stay hydrated. Avoid scratching the rash, as this can cause infection. If you have a severe case, you may need to stay in the hospital. This allows doctors to monitor your condition and provide support. Section 5. Protecting yourself and others. Prevention is key. In today's interconnected world, it's more important than ever to take proactive steps to safeguard our health and the health of those around us. There are several effective measures you can take to protect yourself from Mpox, a contagious disease that can have serious health implications. One of the simplest yet most effective ways to prevent the spread of Mpox is to wash your hands often with soap and water. Make sure to scrub all parts of your hands, including the backs, between your fingers and under your nails, for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Hand sanitizers with at least 60% alcohol can quickly reduce the number of germs on your hands in many situations. Avoid close contact with people who are sick, especially if they have a rash. Mpox can spread through direct contact with infectious sores, scabs, or body fluids. Do not share personal items like towels or bedding. These items can harbor the virus and facilitate its spread to others. Clean and disinfect surfaces that are touched often, such as doorknobs, light switches, and countertops. Regular cleaning can help reduce the risk of transmission. If you're a healthcare worker, wearing appropriate personal protective equipment, or PPE, is crucial when treating patients. This includes gloves, masks, gowns, and eye protection to prevent exposure to the virus. Vaccination is also available for people at high risk of exposure. The vaccine can help protect you from contracting Mpox and reduce the severity of symptoms if you do get infected. Talk to your doctor to see if vaccination is right for you. Your healthcare provider can offer personalized advice based on your health history and risk factors. Remember, prevention is key to maintaining a healthy community. Section 6. Addressing concerns, facts over fear. It's normal to feel concerned about Mpox, but it's important to get information from reliable sources. Don't believe everything you see on social media. Rely on trusted organizations like the CDC and WHO for accurate information. Mpox can affect anyone. It does not discriminate. It's important to treat everyone with respect and empathy. We are all in this together. By supporting each other, we can overcome this challenge. Section 7. Working together. The power of community response. Controlling the spread of Mpox requires a community effort. We each have a role to play. By following public health recommendations, we can protect ourselves and others. Community leaders can help spread awareness. They can share information about Mpox and how to prevent its spread. They can also encourage people to get vaccinated if they are eligible. Combating stigma, empathy, and support. Stigma and discrimination only make things worse. People with Mpox need our support, not our judgment. We must treat them with compassion and understanding. Spreading misinformation or blaming others helps no one. Instead, let's focus on sharing accurate information and supporting those affected. Remember, anyone can get Mpox. It's important to show kindness and understanding. The role of public health guidance and resources. Public health officials are working hard to control the outbreak. They are tracking cases, identifying close contacts, and providing guidance to healthcare providers. They are also working to educate the public about Mpox. They are providing information on how to prevent infection, recognize symptoms, and seek care. Trust the experts and follow their advice. Staying informed, reliable sources for accurate information. In today's digital age, misinformation can spread quickly. It's crucial to get your information from reliable sources. The CDC and WHO websites are excellent resources for accurate and up-to-date information. Your local health department is another valuable source of information. They can provide guidance specific to your community. Stay informed and stay safe. Our shared responsibility, protecting ourselves and each other. Mpox is a public health challenge that requires a collective response. By working together, we can slow the spread of the virus and protect our communities. Remember to practice good hygiene, follow public health recommendations, and seek medical attention if you experience any symptoms. Let's support each other, combat stigma, and work towards a healthier future for all.